power and majesty. We glorify you all days because your mercies are new every morning. We thank you for the life of this hospital. We thank you for the foundation objectives. We thank you the far you have brought it. All the departments functioning. We want to praise your name for the partnership with DNDi and all who stand behind DNDi for this great work. The healing and treatment of Karamoja and with all other diseases. We know this is a ministry. Jesus Christ, you founded. You healed the sick by touching them. You healed them even by your word. And now we stand today to give witness and testimony of the continuity of this ministry of healing by this great laboratory that has been built to be able to facilitate the bigger numbers and people who may come for treatment and testing. We thank you for the government of Uganda. We thank you for all the arms in this country and with the collaboration with the partners that has enabled this to happen. We now gather today to witness the opening of this new laboratory. May your power and grace and mercy be upon all that is going to take place today. And as every program takes on, you who is present in the Holy Spirit, be present with us to take us through all these good celebrations and witness. For we ask you in the name of God the Father, the Son, and the Holy Spirit.
I take this opportunity to thank Dr. Sagaki and his team.
I want to start by recognizing the presence of our Bishop-elect, Bishop Michael. Just stand up for recognition.
May God bless Amudat Hospital. May God bless Amudat community. May God bless Amudat Church. Thank you.
In the same way, I would like to thank the government of Uganda for the spirit of partnership, which is very prominent in Uganda.
For me, I was very clear at the time. We might even have a handling of government. But it was not a wise thing. When Dr. Sagaki came with the DNDi program, it changed everything, even in my own mind.
I'm Dr. Fred Mubanizi. I'm a Assistant Commissioner, vector-borne infectious diseases, and I'm also representing the Commission on Environmental Health, was also the
I have known Dr. Sagaki for a long time. We met many years ago when he had more hair and the color was a bit different from what it is today. So despite all my years of practice, I've practiced for close to 20 years, more than 20 years actually. I've not seen a patient of Karamoja, visual leishmaniasis.
One, I want to say we are very grateful today as the people of Amudat, most especially to the government of Uganda, for allowing partners to freely exercise their mandates in our region and in our district. First of all, let me appreciate DNDi for the support.
Karamoja and your team. God bless. Amudat, you found a very small minority tribe to come and invest very good infrastructure on this. We shall never forget the DNDi. Thank you very much, DNDi, Karamoja, and the team Bolo na group yako. Asante sana.
I welcome you all to our hospital and thanks so much for taking time off your busy schedules to come and join us in celebrating our new achievement. This is a 120-bed hospital. We are having 5 wards, as you saw them. What makes it probably special is that we are in the endemic area for Visceral leishmaniasis, otherwise called Karamoja, and we had the opportunity to be the first treatment center of Karamoja. I'm going to mention these partners, not listing them according to importance or the magnitude of whatever, but it's just a random mentioning. We have got Ministry of Health, UNICEF, World Health Organization, IDI, UPMB, that is Uganda Protestant Medical Bureau, QAM. We have End Fund, who support surveillance in Karamoja programs especially, and the NDI, Drugs for Neglected Diseases, whom you will realize that is the biggest funder for our hospital and the Karamoja project generally. In that process, we have been supported as human resource. They have taken us to school. I came here with 1 degree. They supported me to go and do my first master's, which I did from Thailand, in Bangkok, in tropical medicine. They again supported me to do a master's in public health from here. Many of my colleagues are being supported, and I talk by next month they are supporting 2 members of our hospital to go for their master's programs. They have so far since 2007 bought for us 3 Land Cruisers. Hardly 1 month ago, I think like 4 months ago, we bought a new Land Cruiser. They support us in renovations and now construction of this magnificent lab and the kitchen. Please, thank you so much for supporting us. That's the DNDI team.
I have always advised my colleagues elsewhere. I said, civil service or public service is a ministry and it's a sacrifice. It is not meant for rich people or people who want to get rich. If you want to create wealth and you're in civil service, you're in the wrong place. Go to the business world. This is total service, sacrifice to the community. Because somebody who is in business sees this waste of time, coming and sitting here from morning to sunset, every week, throughout the year until you grow old. But once God has called you to come and serve His people, let us serve diligently. And we will serve in faith, hoping we shall be paid one day. So, let us dedicate ourselves, come to office early, stay in office up to required time, treat our patients humanely, and sacrifice for them. We want to see improvement in service delivery every day. Let me take this opportunity to thank the Almighty God for having allowed us to come together in this number to celebrate the success and the birth of a new facility in the district. Hospital is a very important facility in the lives of humanity because that is where our health is repaired when it's broken down. I would like to thank the Church of Uganda through the Diocese of Karamoja for having allowed to partner with government and to allow government to step foot here. And that's how we are seeing services being offered to our people. I cannot forget to recognize the contribution of development partners, and notably is DNDI. I would wonder where we would be without this support, and I would wonder when we would get this kind of magnificent facility, if not because of DNDI support. I want to end here, and I wish you safe journey and journey mercies when you go. Those who are going outside the country, take our regards across the border. Colleagues going to Kampala, take our greetings to our team in the ministry. And for us who are here, when you go back home, tell the community Amudat Hospital is for the community, and let them come and be treated in the hospital. I say all this for God and my country.
So I want to thank the teams for a very good job done here. Last week we went to Karita sub-county. We were just trying to do a sample. We said we are getting complaints from the public that there is staff absenteeism, late coming. What could be the relation of that and the medical personnel owning these drug shops? So I led an intelligence operation, and I was amazed, actually the entire team, that in all the 12 drug shops that we inspected, there was not a single government drug. I thought the health workers would applaud that. That speaks of very, very high ethical standards of our workers, because this is a challenge in a number of districts. You'll find the drugs that are being sold in the clinics, in the drug shops, are the ones that are meant for the people in hospitals. However, we noted that I think because we've not been having labs of this nature, we found that in drug shops, patients were being admitted. Patients were being, all the entire hospital chain of activities was being conducted. But again, because they are rendering a service, it was good to let it go. So with this lab, I'm very confident that we are going to improve on the health service delivery here. When doctor took us around the hospital, I was expectant of one facility, which he didn't take us, and I don't know why. I did not see a mortuary, because you know that whoever comes to the hospital, you have two options. Either you'll go back when the head is facing in front or when the legs are facing the hospital. So I would be interested, doctor, that before this we see the state of the mortuary. I don't know whether it is self-contained, we don't need any support, but I think that is one area that we want to appeal to our partners to support us, in addition to the others like the X-ray. It's very, very important that we have a fully functional mortuary so that we are able to help those whom God calls home at the appropriate time. My Lord Bishop and the guest of honor, I want to thank you very much for coming to Amudat, but allow me to register my apologies so that I'm able to leave immediately. I have a team in my office, they've been waiting for the past an hour, and I need to go and rescue them. But I want to wish you the very best, and thank you for coming. Please come again. I say this for God and my country.
About the quality enhancement of our services. Every person in Karamoja have what they always say. You will hear them say, that there is God in Matany. Because every time a referral is made, someone is assured that I will go there and come back when I'm well. But we want now, with this, that DNDI has set, to also begin saying that there is God in Amudat. So that if someone comes from Turkana, someone comes from the other part of West Pokot, they will know that there is life. There is an assurance to get life when you step in Amudat. There is no guesswork these days. Everything is about research. And we are grateful that Amudat is going to be a center of excellence, that you have to study and come up with proven treatment for our people. There is a big challenge that people of Karamoja have: poor health-seeking habits. But when you have facilities to enable the health workers go for outreaches, it closes that gap. It reaches out to those people. There was an intelligence-led operation that was done in the private clinics. But to tell you, there was no government drugs that were found in any of the clinics. So I think there is professionalism now amongst our workers. And that is the way to go. Again, government has made it a bit very easy for us to do our monitoring, because every time they dispatch drugs, NMS sends us a message. They have delivered these quantities to this and this. So with that, it has made us to monitor these drugs when they come in and at what period it takes. This is our brand. Just like you will go to Kumi and you hear there is a hospital of bones, we also want to be known for this. And you said, okay, we are going to give you the laboratory. So the laboratory is here within a very short time. Thank you so much for living by your promise. This thing of saying that the disease is for the poor. Karamoja, I think we are so much overburdened now. Almost everything is resting on us. The poverty, the health indicators, education, water and sanitation. So we want to get out of some so that we can also say we are no longer there. I am aware that so many Pokots go to Moroto seeking for services, but it is challenging because of language. Sometimes they go there. We need to have representation from Amudat so that we have someone there. If it is even posting a nurse or someone, let's have somebody from here who speaks the language. So otherwise, with all those, I want to thank everyone who has graced this occasion, who has contributed to this achievement.
Indeed, Amudat Hospital was started in 1957, 67 years down the road, by a doctor called Dr. Cox, a missionary. Until the DNDI came, I know many staff have come and left. Over the years, I thank the district of Amudat, which was, first of all, under Nakapuri period, for seconding. You know, Dr. Sagaki has been working here as an MS, but He is a seconded staff by the district of Amudat. I salute you, district of Amudat. I want to greet and to salute the NDI and all those people who have facilitated the trials of drugs here. Kalasa can be treated in 17 days. This is a great achievement. Thank you. I thank you very much for many endowments that have come here. Now this block is going to be very important, a typical laboratory, which will test, I think, not only Kalaza, but also other diseases. Thank you very much. This is great. We salute again the DNDI. There is one person who is not always mentioned. She is called Madame Jane Kujuke. Where is she? She is the administrator of the hospital. She is there unless he confers it to another person. Please come. Venerable Michael Chore.
Combination sound.
Thank you. Thank you. Praise the Lord. So there is no shortcut, and I believe that this learned man is more learned than me, is more taller than me, and so many things than me. I'm sure it's going to lead this diocese to another level. And being a cohort, please work with the districts, comrades. And these men that are now in power, I can see they can reach us to other heights.
I take this opportunity to thank Dr. Sagake and his team, and I wish them continued, what do they call it again? Another what? Another what? Another round for Dr. Sagake. It looks so simple. It looks so simple, but it has been hard work. This is a testimony I want to give you. History is useful sometimes, and I feel this time it's useful. I started some laboratory work on leishmaniasis, Kalaza, in a different country, not Uganda, but very far away, almost at the end of the world, early 80s. Would have worked on malaria. HIV was not there by then. I would have worked on TB, but I chose to work on leishmaniasis, Kalaza, not knowing what lay ahead of me. It was more of an academic passion. I think it's very, very important. You need a team leader who can lead you. You need a general like Sagaki who works tirelessly. There's a saying that if wishes were horses, beggars would ride. But we are not beggars. We are an established medical facility. And I think Amudat deserves this and other better facilities to serve this neglected community. This laboratory is not only for Kalaza, it's for all diseases, and that is the benefit we are getting from Kalaza, which though was neglected, is not very much neglected now. I would like to request the Ministry of Health, represented by Dr. Alfred. I'm very happy that you have identified with Kalaza and also with Amudat, Amudat Hospital, Matine, and all the other health centers in the region. Please try to lobby for us through our good friends in the ministry so that more support is sent this side. And the guest of honor who has surprised me, he told me he was in my class at the medical school. Thank you very much, sir. God salute the district leadership. This is something to be proud of. It's something to offer. We can get most of our services in Amudat. That's what we want.
On behalf of the Minister of Health and on my own behalf, I would like to thank DNDI for the long-standing collaboration and partnership, support towards the elimination of NTD, especially Kalaza. Kalaza in medical terms is called visceral leishmaniasis, and visceral means those organs they have talked about. The disease affects those internal organs, the spleen and the liver. So if you see someone with extended abdomen and you try to press, in medical term we call it palpate, you press and you feel those hard things, the spleen or the left, and then on the right, that's the liver. Then you suspect it. And it is endemic in Karamoja. In the whole region, it is only localized here in Karamoja region, 9 districts. We actually brought health workers from Moroto, and actually they told me that they had lost many patients with, they didn't know that it was Karaza. So we brought them here, health workers, we trained them. Sagaki was here, because with support from DNDI, we trained health workers. We said, now we have built your capacity, you manage your patients from Moroto Hospital. They have signs and symptoms like of HIV. It is negative. They test for malaria, it is negative. Then they think this patient is bewitched, and they leave patient to die. My colleague has already told you the signs and symptoms. If you have a patient who is presenting with fever, persistent fever, they have checked malaria, it is negative. They have checked HIV, it is negative. They have checked typhoid, it is negative. The next thing should be Karaza. And you bring the patient here for the test. That's why the lab is here. In the past, we didn't have enough equipment to test. But this lab will be able to test the patient and will get the disease. Now, having known the symptoms, you have to know how it is transmitted. The disease is transmitted by sandfly. Sandfly, you need to collect my colleague, my senior, I think is now more in medicine, in obs and gynes. But this disease is transmitted by sandfly. And these sandflies, they are here in these anthills. Once you destroy those anthills, then you will now deny them where to hide. Then again, use mosquito nets. You encourage your people to sleep under mosquito nets. It is not only for poor people, even you. If that sandfly bites you, it is like the mosquito biting you. If it has malaria parasite, you will suffer from malaria. So once we deny them where they bleed from, and then we sleep under mosquito nets, shall not suffer from Karaza. I know you are tired with those few words. I pledge to end here for God and my country. Thank you.
Because without evidence, we shall only be practicing witchcraft. I think even in Mama Fina, for whom we all know, will be better than us. So thank you very much that we are investing so much in research. The disease that has made us to be here today, Karaza or visceral leishmaniasis, is a zoonosis. Zoonosis refers to a disease that is transmitted from animals, could be wild, could be domestic, to humans. So leishmaniasis is a disease that is from animals. We are going to support this facility, and at this moment we are going to facilitate to support it by way of minor repair and services. The equipment that are there, we have had a great improvement when you look at the league table, which normally Ministry of Health publishes every year, every financial year. Karamoja, for the very first time, you'll be amazed to look for it. You look for it from the behind. Karamoja district, you will not see it. You will not see any from behind, from the last. You have to start looking from the best, from the number 1, number 2, number 3. That's where we are now. So Karamoja, I want to really applaud the leadership, and of course our partners who have made us do this. And I want to just applaud the medical practitioners here for the ethical behavior, for not snatching some drugs which are for these needy people, vulnerable people, and take them to their clinics. I think I just wanted to add that one to the healthcare workers, that is something that we need to uphold as all of us as the healthcare workers, to uphold the dignity of our profession. I think that is very good. So I would like to stop here, and thank you so much for allowing me and also having me to be part of this congregation when we are celebrating this great achievement and our oversight role in the region. We have the community health department in the regional referral hospital, and that is the one which coordinates all partners in the region, all efforts in the region. So Dr. Sabunyo is here, is the head of community health department or public health department. He has also come, actually he came yesterday, and he has been here to see that we are really part and parcel of this development. So with this, I want to congratulate Amudat district and Amudat Hospital and Dr. Sagaki and the entire staff upon this great achievement. I want to end here. Thank you so much.
Let me also recognize the district leadership. All the times we've been here, we have had the district leadership with us. The area MP has been a champion of this hospital. Thank you very much for that. When DNDI was established in 2003, we just celebrated 20 years last November. Its sole aim was to be able to provide the best science for the most neglected. And in the 20 years that we've been in operation, DNDI has delivered a total of 13 new treatments for 6 of the most neglected diseases, a big achievement. And we haven't done it alone. But you can imagine that when you deliver a total of 13 new treatments to neglected populations who had no voice, then we do something that is able to change the whole paradigm of people who are neglected and give them a voice to become useful members of a community. To be able to eliminate Kala-Azar by 2030, it gives me very, very great pleasure to be here today to inaugurate and commission this wonderful facility here. This new laboratory will not only serve patients coming here because of Kala-Azar, but also other community individuals and patients. So it's going to be a game changer for the whole region. By that, we hope and we trust that by 2030, when we hope and expect that we'll have eliminated VL or visceral leishmaniasis or Kala-Azar as we know it, that goal will be reached because of the partnership and putting effort in being able to detect the patients, treat them properly. We cannot do that without facilities like we have here today. We cannot do it without people who are well trained to make a proper diagnosis for our patients. And number three, we cannot do that unless we're able to deliver quality medicines to treat those patients. And that is the aim of DNDi and its partners. And we are looking forward to be able to partner again with Amudat Hospital, the community here, to be able to move forward the fight against Kala-Azar and other neglected tropical diseases. Dr. Sagaki has stuck here for many, many years. Really, that is a sacrifice for service to humanity and his wonderful staff here. Let's continue supporting this hospital with even more people that we can train and retain here to be able to support our patient population. May God bless Amudat Hospital. May God bless Amudat community. May God bless Amudat Church. Thank you.
The product that you are seeing here, even though he was not involved directly, he has been part and parcel of this journey. Thank you very much, Professor. Dr. Sagaki, as you're talking here, I think we were discussing with my seatmates that this guy looks like a politician. About 5 months ago, when we managed to get some funding from the Germans, I was asked specifically whether we can be able to deliver on the promises that we were making. And I remember I came and sat down with Sagaki. I told him we don't deliver by May 31st, then all the funding was going to go back. He said he was going to talk to the contractor, and from there he'll give me his answer. And when he gave me his answer, it was an affirmative yes. I talked to my boss, Professor Karamoja, and we decided to have a plan on how we are going to deliver. Thank you, the team of Amudat, for the continued work. It is not about this project, but we all know that it is about the patients, Kala-Azar patients, that we continue to support. What I've come to learn over the years is that we cannot do these things alone, even as DNDi. And the most important thing is the leadership, the political leadership, taking ownership. And I've seen over and over again, whenever we come here, I bring visitors. Dr. Sagaki is always ensuring that the leadership are here. The first country that can be able to eliminate Kala-Azar is Uganda. Why? Because one, the disease is localized in one area, which is Karamoja. We have fewer number of patients than compared to the other countries. But most importantly, we can see political commitment, which is a very key ingredient in eliminating the disease. Southeast Asia, which has eliminated the disease, that is starting with Bangladesh, Nepal and India, the key ingredient that ensured they reached the success was because of political commitment. We are going to set up a meeting, probably sometimes in September, to kickstart the elimination program for leishmaniasis in Uganda. We hope and pray that these facilities are going to be well equipped. The central laboratory are planning to make it a central referral laboratory for this region. I hope that is going to be done. We are going to train the people so that not only Kala-Azar patients benefit from these facilities, but the entire community of Amudat and beyond. Asante sana. Thank you.
You know, I was here since 1981. That's when I entered town. I entered town from our rampant business we used to have in Karamoja called cattle raids. That's when I entered Amudat. I found myself entering Amudat forcefully, not my wish. Then I found myself in Amudat Catholic Mission, idle and disorderly. But later I enjoyed because I was dressed and I was told there's a place called a class, and that's where I proceeded from. But this treatment of Kala-Azar when it came, true, Alfred, we were enjoying 30 injections in 30 days, but very painful. So, Olobo, I think you are like a missionary. Father Mark and others who made us join school. We could have remained somewhere, either in Turkana or in Ablatuk or in Matheniko, go and look for cows. Because in raids, there are two options. You succeed or you remain there. But Olobo, I think you became one of the missionaries. When we came from the village, the first cloth to dress on was from the missionaries, because we came from home when we were very smart. We were very smart, just clean as you came from your mother's home. But we found ourselves being given something to hide on. But you know the other one, we said exposure. So Olobo, how you decided to say from 30 to 17, I think it's only God that should reward you. My ndugu chief guest, Karamoja, yes, we have health centers, health center hospitals, and health center 2, health center 3s. We need you, we need the ministry to upgrade the health center 2s into health center 3s. My chairman has just told you, in the entire sub-county, not even one, something similar to health center, nothing. So they are living at the mercy of God. We need to thank DNDI for giving us this facility. We need to thank Church of Uganda for providing the land. Until Alfred, until, you know, the benefits we get from until, that's another food of thoughts. So you have told us to destroy. Now I was saying, what about the other one? So my chief guest, I don't have much. I'm only very happy that you are around to officiate the lab, the opening of the lab. And my elder brother, Olobo, the one who brought us here, made sure the Kalasa must be treated, and the entire team of DNDI. It is my singular honor, my brother, to invite you to address this gathering.
For us, when we would hear of Amudat, we would just think the hospital here, we just knew only one thing of Kalaza. And I think you have made a name for yourselves as this hospital in treating this disease. And I think you all deserve congratulations for that. Laboratory services are very critical in the delivery of quality health care services. The laboratory plays a central role in disease prevention, control, and management through timely diagnosis and treatment monitoring. So Amudat Hospital is one of the hospitals that has been selected to be one of the hubs in this country and for this region. Accreditation of the laboratory is a very important exercise. This means that the tests that are done and the results that are produced from the laboratory are recognized internationally. So once we get accredited, it means that a test done here meets all the standards that are international, and therefore it can be trusted. So therefore it's important that all of us as stakeholders work to support the accreditation of this Amudat lab, and I hope that that will be done, will be in process. I want to ask all implementing partners to continue supporting the delivery of laboratory services within the Karamoja region, including remodeling of other laboratory infrastructure as by the infrastructure guidelines. I would ask the DHO's office, the hospital management and laboratory team to ensure that they maintain the infrastructure and that the laboratory provides quality services to the community within Amudat. I'd also like to thank the contractors for the good job that they have done. Special thanks also goes to the Church of Uganda for allowing this facility to be shared or to be a Ministry of Health to operate from here. And also to the district administration and the political leadership in the district for the support that they have given to this facility. Finally, I would like to extend my appreciation to Drugs for Neglected Disease Initiative, DNDI, for supporting the remodeling of the Amudat Hospital lab. As I end, it is now my singular pleasure to receive the new remodeled lab here at Amudat Hospital. And finally, I would like to thank you all very much for coming. So thank you very much, ladies and gentlemen, and I officially receive this laboratory, and I hope that it will be well used. Thank you very much, ladies and gentlemen.
Jehovah, hakika tumeona, tumekuona.
so much, the team. We honor don't pray, but we pray and also entertain our patients. Watu wako umewapa mamlaka kwa jina lako Yesu, waponye. Na ubaguzi wote ni sawa kwako, umetuita Yesu, tupone. Tumeuona Baba, mkono wako Bwana kweli, matendo yako Bwana ni makuu.
Walitoa mbali. Our guests, thank you so much for coming. And let me give a chance to the next person. Thank you so much once again.